Good afternoon. My name is Shirley Stock, and in August 23rd, 2005, I lived in Lafayette, Louisiana. That was the day Katrina hit New Orleans.
And when you pull back for a wide shot, the scene is nothing short of apocalyptic. 80% of New Orleans, including much of downtown, is underwater. The Big Easy's famous Canal Street, living up to its name. And rising waters will now force officials to evacuate the shelter at the Superdome. Katrina's departure was just the beginning of the misery.
We were asked to open up a floor on the hospital, not necessarily to take care of patients that were injured, but there were some nursing homes that were not able to take care of the patients, and so they brought them to us to take care of. These were people that had feeding tubes, that had catheters, that had a lot of different that were not able to take care of themselves, and so we were able to take care of them, give them the things that they needed, and we did that for probably a week or so, to be able to take care of them. When these patients came, they were not able to speak or to walk or to do anything. They came with labels on them with their name and their date of birth and the next of kin, and then also they came with a week's worth of medication, and that's all we knew about any of them. So it was challenging to try to provide care with someone who couldn't talk and you had so little history of, but we were able to take care of them. They all left in the same or better condition that they came in, so that was rewarding for us because it was challenging to take care of them. When this happened and we got called to come in, none of this was a surprise to those of us that got called. We had had trial runs, we had had practices, we had had in-services. We'd spent all day on what to do in case you have to come to the hospital, in case there's some kind of disaster or emergency. You may not be able to rely on food from the cafeteria or someone cleaning or even a bed to sleep in. They gave us a list of what kind of things we had to have ready to go, and they should be kept in a special place, in a closet or someplace where you knew right away that you could get those and get to wherever it is you needed to go. It wasn't anything last minute. It might be like you might not know you were going to get called that time, but you were going to get called at some point, okay? And so they expected that you would have all these things ready to go, your medication, whatever you needed to survive for your 36-hour shift. It could be less, it wouldn't be more, okay? So, like I said, we didn't know it was coming that day, but we all knew that at some point it would be our turn to go in and take care of patients when it wasn't our shift, when the weather was bad, when the roads were out, whatever the circumstances. They only brought in essential people.
Right.
So it's not like we had housekeeping or anything like that. They just brought in essential people. So we didn't have everything you'd expect to have in a hospital. The regular nurses evacuated with the families. A lot of them didn't return. And so that's when we had to get temp nurses from all over to try to help us out. Mm-hmm. So we had no communication with the outside world for probably 3 or 4 days. The only communication we had was the director of the hospital was a ham radio operator, and so he would contact patients or he would contact the people that he knew in different countries, and they would give him the information that he would then give us about what was going on in New Orleans. And so that was we didn't have any phone service in the hospital, so to communicate we had to use walkie-talkies. We were able to communicate with our family. We didn't have any cell phones, so we couldn't communicate the first day or two, and because there was no cell phone transmissions, and so they were concerned. But probably after the third day or so, we were able to communicate with them and let them know that we were okay and we're staying. They kept looking for us to come up their road. We didn't come up. We stayed. Another thing, because we had frequent outages down there, and sometimes, rain disasters, my son and his wife and children lived down there, so we always had a plan as to if we had to leave, what road we would take and where we would meet, so that if we didn't have phones, we would be sure that we would get to the same place. So that's a good idea to have also. We are on I-10, which goes from New Orleans straight through Lafayette, so everyone who came through got gas, went to the grocery store, went to the ATMs, and so we had lost a lot of resources because there was nothing left once the traffic got through. So 3 or 4 months after the hurricane, my daughter came down, and she and some friends went to drive around, and they went to Biloxi to see what had happened there. So when she came back, I told her, I said, I want to go to Biloxi too, because my husband and I went about 3 times a year. Beautiful houses, lots of trees. It was so pretty. And she said, you don't want to go, Mom? And I said, I do. So I talked my husband into taking me, and I cried and I cried and I cried, because there was nothing left of all those houses and all those trees. It was really, really sad. So it wasn't just New Orleans, but it hit in Mississippi also. Oh, New Orleans, you couldn't even get close to it. There was nothing there. And so we frequently had outages in the area that we lived in Louisiana, so we always had a gas grill ready to go in case we needed to use it. Just a little reminder that those things, gas grills, charcoal grills, should always be kept outside to avoid carbon monoxide poisoning. Rather than call during a large-scale disaster, it's more efficient and effective to text, so that's something to keep in mind also.